There seems to be an underestimation of a true potential of AMC Part 1 exam. Firstly, it gets compared unfairly to PLAB Part 1 exam, which I think is not right, as after passing AMC Part 1 exam, you can straight away apply for jobs here in Australia. Secondly, doctors often think AMC Part 1 exam is only for fresh graduates. But in this video, I will explain why AMC1 exam is equally important for mid-level, senior doctors like GPs, and even specialists who are thinking about applying for competent authority pathway. For elements, I'll divide this conversation into why is AMC exam so important. Number 2, AMC1 exam success rates. Number 3, convenience of taking the AMC Part 1 exam. Number 4, AMC1 exam for fresh graduates, for UK membership doctors, for GPs and specialists. And then I'll give you my final recommendation based on all of these factors. I like you to think of AMC1 exam as a catalyst in a job recruitment process. The fundamental concept is the better your clinical experience, the better are your chances of having a job after AMC Part 1. And to be honest, same can be said for PLAB and USMLE exam as well. That is why you see fresh medical graduates doing research, publication and conference presentation, and often being exploited by first author to do the legwork and be fourth and fifth authors on the citation titles. Later, they also do expensive overseas electives, observerships, seeking crucial local references. As doctors do know, simple PLAB and USMLE is just not enough for the very first competitive medical job in US, UK and in Australia. The success of AMC1 exam. Now, AMC1 is a simple final year MBBS subject-based exam. If you pass basic medical qualifications and you've done your internship with an average study of 3 to 4 months with full-time work, they will pass the exam. The people who may struggle are the ones who have clinical gaps and not completely invested in the process of taking the exam in terms of discipline and preparation. Now, I've seen recently doctors with 8, 10 and even 12 years of career gap passing the AMC exam in first attempt with just 4 months of solid preparation. So there is really no reason to put it off, especially when this exam is working as a catalyst for you and having your first job here in Australia. Now, if you're a busy working doctor, you don't know where to start, you don't know where the latest resources are, I recommend you join #1 AMC course here in Australia, that is Emergency Focus AMC Part 1 course. That'll give you all the resources that you need to have to be ready for this exam. We'll provide notes, videos, presentation, trial exam question through your online portal, plus a little boot camp at the end. You can access all of our materials or AMC course via apps and PC and laptops, and our live classes are conducted in the evening, which is much suited to people from anywhere in the world. You can register for our next course at www.emergencyfocus.net/AMC. Availability and convenience. The AMC Part 1 exam has 6 dates on an average, including onshore dates and offshore dates every month of the year. It has 17 centers only in India, in addition to centers in Singapore, Bangkok, Myanmar, Philippines, Hong Kong, China, UK, France, Germany, Turkey, and pretty much all the states in the US, and even in Johannesburg, South Africa. It costs about $3,500, which include creating AMC profile and MBBS degree evaluation. Now let's talk about the convenience. It never expires. So even if your plans change or you need more time to get some more clinical experience, it will always be valid. AMC is the only exam that lets you apply for jobs in Australia right from your own country. And that is a big convenience, especially for people who are living in India, Philippines, Myanmar and Thailand, IMGs in the UK and US, because you can take the AMC Part 1 exam by being in those countries. And just to make it factual, in the last 12 months, I have personally assisted some doctors with interviews who were shortlisted whilst being in India, just because of their excellent credentials and no gap CV. AMC1 for fresh MBBS doctors. The question that I often get asked by young doctors, how long after passing the AMC it will take to get the first job? The answer is actually quite simple. Complete the clinical experience of internship and RMO on top of that for 12 months, so total about 24 months. And especially in the fields like emergency, ICU, medicine, do important courses like BLS, ALS, procedural skills course, communication skills course from good providers, and ensure your CV has got no gaps. And if it's got gaps, they are justified with some kind of job that shows some patient dealing or interaction like communication, empathy. Even jobs like medical administration, nursing and disability sectors can show that level of commitment which recruiters are looking for. After this, you have to make your perfect CV, and trust me, you will get shortlisted for your first interview. Employers actually like young, fresh, trainable doctors who are energetic and full of enthusiasm. AMC1 for GPs. Now, if you're a doctor with extensive GP experience in your home country, there are pathways like pre-structured clinical interview and fellowship support program that allows you to get GP's job in Australia straight after AMC. Please check my videos on GP pathways in Australia to see a detailed information on that. Mid-level doctors with UK membership exam. Now, there are many doctors in Middle East, Pakistan, India and UK who have extensive and excellent clinical experience in the UK even and native countries. And they've passed full MRC-EM, MRC-S, MRCP exam. My advice to them is simple. If you want to work here in Australia, you have full GMC registration through membership exam, and you are currently working in UK or Ireland, do yourself a favor, please take AMC Part 1 exam. Hospitals are desperate for experienced doctors like you. Job situation has always been favorable for these mid-tiered, mid-level experienced doctors. The only thing which is limiting you right now is simply AMC Part 1 exam. So do consider this. Now, what about the specialists? Now, I do a lot of one-on-one career counseling sessions for specialists from India, Middle East, Pakistan, and recently people with MD, MS, FCPS have applied for specialist pathway. Now, those of you who are familiar with specialist recognition pathway, it is an extensive process, a lot of paperwork, but on top of that, you are expected to pay $8,000 to up to $10,000 upfront, which is twice the fee of that of an AMC exam. Now, let's imagine you're recognized as partially or fully comparable specialist. Next step is to do 6 to 12 months of supervised registrar level job in your specialty in Australia. And seeking these kind of jobs in surgery, orthopedics, gynae, dermatology, cardiology, radiology, and many other fields, you will be competing with young Australian doctors and you will hit a bottleneck. I know some overseas cardiology MD and ortho MS who were not able to find supervised level jobs and they wasted their $8,000. Again, my advice would be to act smart. Do AMC Part 1. Take the unaccredited registrar level job. If you are, surgically inclined, take a job in AD. If you're inclined towards anesthesia or ICU, take an ICU registrar job. If you're medicine inclined, take a medical registrar job, which might be an unaccredited job. And in this way, get some Australian experience, meet people, develop an understanding of your own area of specialty and how to go about applying in Australia. And then after a year, you can apply for specialist recognition in your own field. In this way, you can show local Australian experience, local references, plus you will be earning here in Australian dollars in the meantime. So it's a win-win situation. Now, I know a doctor from India who was fully qualified as an interventional cardiologist, who worked as an acute medical and later as a neurology registrar and developed good links, references, and then applied for specialist recognition and was granted to work as a cardiologist, and now he has a very busy private cardiology practice. So my recommendation, if you have little or no clinical gaps and have at least 2 to 3 years of clinical experience, then after passing AMC1 and having a good CV, you will not be disappointed and you will get shortlisted for an interview. For doctors with 3 years of GP experience, consider doing pre-structured clinical interview pathway after passing AMC1, and you can always later enter into a different GP pathway leading to a full GP fellowship. Number 3, doctors who have passed any UK membership exam, have current UK clinical experience and have current UK GMC registration, please consider doing AMC Part 1. Trust me, you will have no trouble in getting job interviews here in Australia. Number 4, if you're a specialist MD, MS, FCPS, then it actually makes more sense to do an AMC Part 1 and work in Australia before applying and investing $8,000 into specialist recognition pathway. Number 5, AMC Part 1 might be the only exam that you need to do. If you are able to get into WBA program, you may never have to do AMC clinical exam. And then after completion of WBA program, you can apply for a general or full registration with APRA. And straight after that, you can apply for permanent resident visa. Now, things are favorable for the next 12 to 24 months in Australian medical industry. Plan it smartly and you will not be disappointed. I hope you like this video. If you need any help with AMC Part 1 or have any question, drop them in a comment section below and I'll respond. As always, look after yourself and each other. Goodbye.